Good afternoon, Phoenix. Welcome to the Good Life with Lance Dreher, Dr. Fitness. That's me. Welcome to the show. If you're a first-time listener, let me give you a little bit of background on myself so that you understand I'm here to help you. Baby boomers, primarily. I know Keith the Green was talking about boomers the last hour, and we're going to take that path too, because my show's geared towards people my age. I'll be 69 years of age here in a couple months. I'm one of you, gang. Really am. So, every week I spend some time trying to decide exactly, what I really want to talk about when it comes to our health and well-being and how to live a more productive, longer, good life. And, what would be a good subject matter to discuss with my listeners. And a good friend of mine, one of my clients, Jim, he sent me a text a couple of days ago, what about statins and dementia? And it was interesting enough that I was more inclined to go in that direction based on some of the information I was putting together for my show, basically on ketones in the brain. Okay. And so I dug up more material and some of the stuff I've discussed over the years, how certain lifestyle habits actually affect that and what the effects of statins are. Just, as a disclaimer, I'm anti-statin. Just remember that. That's my disclaimer. I'm not a medical doctor. I'm not a pharmacologist. Okay. I'm not. Okay, I'm Dr. Fitness. My specialty is in exercise and nutrition. That's my background, okay? I also do a lot of research and a lot of cross-referencing with experts in these areas. And statins presently, if anybody in this country over the age of 50, they recommend to get on a statin. That's the MO. And they've been pushing that for many, many, many years. And just more recently, they've been coming up with all kinds of studies showing the negative effects of statins, of course, with their disclaimer, don't stop taking your drug unless your doctor directs you to do that, that the benefits will outweigh the risk. And one of the risks of statin drugs, now bear with me, I'm going to put this together for you, where I'm going with this, is the increased risk of developing type 2 diabetes. Type 2. Insulin resistance diabetes. What that means is your body's producing plenty of insulin, you're not using it correctly. So it takes more insulin to get your blood sugar down, and over time you can't do that well enough, so your blood sugar goes up and they classify you as a type 2 diabetic. Well, statin drugs increase your risk of developing this. And if you don't have it, you can move into that category as having it. And if you do have it, according to the research, it can progress to disease, which means moves you past that point, getting you on more medications, including insulin. That's bad. Of course, then they tell you, don't stop taking this. The benefits outweigh the risk. Well, what's the benefits? Diabetes? Where 85% of type 2 diabetics die of coronary artery disease, cardiovascular disease, strokes, and things like that. That's the benefits? The risk of developing possibly dementia? Alzheimer's? Now, this is from the Mayo Clinic website. The FDA warns on statin labels that some people have developed memory loss or confusion while taking statins. Also says about you can develop type 2 diabetes. This is their bit of getting around you suing them. They're warning you. Memory loss while taking statins. These side effects reverse once stop taking the drugs. Do they really? Depends on how long you're on the drugs. Depends on how many of the statin drugs, the actual amount you're taking over those years. Currently in this country, we have 6.17 million Americans, 2023, with Alzheimer's. Listen to this. This is from Brain Life. Americans can face a tidal wave of dementia in the coming years. According to some estimates, and I'll get this now. Right now, 6.7 million Americans with dementia, Alzheimer's. According to some estimates, more than 40 million Americans will have dementia by 2040. 40 million. Currently, 39 million Americans take statins, up 7 million more in the last 10 years. Numbers sort of jive, don't they? 40 million don't want to have Alzheimer's, and anybody who has a friend or relative or spouse with Alzheimer's dementia knows how bad that is. So is there a risk using statins and dementia, Alzheimer's? According to what I'm reading, there is. But they always cover the butts. Big Pharma is always in position to protect themselves, because they make a lot of money selling you and I drugs. So if you have a medication that lowers cholesterol but increases blood sugar, and we know that blood sugar is tied into brain damage and other damage in the heart and other parts of the body, the risk outweigh the benefits. Right. Okay. Do they really? Did you also know that the brain is largely comprised of cholesterol? Did you know that? And it makes its own? Bet you didn't know that. The brain makes its own cholesterol because it's largely comprised of cholesterol. And if the brain didn't need cholesterol, why would it make its own cholesterol? And the reason why it does that is because the cholesterol manufactured and made in the liver can't cross what we call the blood-brain barrier. It's a protective thing. But statins can. There we go. Statins can cross the blood-brain barrier, getting into the brain, preventing the brain from producing cholesterol correctly in the right amounts. Cognitive problems, dementia, Alzheimer's, statins. There could be a link. Now, I'm not telling you to stop taking your medications. That would be irresponsible if I did that. What I am saying to you is you have control of what goes in your mouth. You have control of your activity. And there's no drug that's going to change that. Only you can do that. And being in my age group, as we get older, you start to develop other issues. They're going to load you up on all kinds of drugs. Take this for this, for this, for this. And a lot of the drugs are used to basically deal with the side effects from the medication you're taking. And here's one for you. Did you realize that many of the heart drugs we take, particularly blood pressure medications, affect blood sugar too? Drugs like beta blockers. And the more you take, the more it has an effect on blood sugar. And here we go again. But none of them have a warning on their label telling you can increase your risk of type 2 diabetes, like statins do. Believe me, the FDA doesn't take this lightly. They just don't put warnings on everything that's out there. It takes a while and some pretty scary stuff to look at for them to put a warning on the label. Look what they did with cigarettes all those years. No warning until all of a sudden there it was. It's on every label now. It's giving you a warning. Could increase your risk of lung cancer. Then we look at the exercise part, how much exercise has a role in prevention and reversal of a lot of the issues that we have today when it comes to our health. And Tufts did a big, long study on exercise and drugs. Study included over 300 plus thousand people with exercise and found that people got at least as or better benefits from exercise when it came to dealing with heart disease and stroke than they did with the medications. Over 300,000. And that it only takes 500 to 600 people in research to get a drug approved. That's it, 500 to 600. So this is all about lifestyle. And my show is dedicated to that. A good life. Because a good life means enjoying yourself. Being able to do things with your significant other, your wife, your husband, a good friend, your family members, your grandkids. A bad life is meaning management of your sickness because you're sick all the time or you're taking a ton of drugs and you're afraid to be away from your doctor. And a good life only comes from the right diet and exercise. I'm telling you that right now. Those two components are critical to a long, productive, enjoyable, good life. That's KFYI, and we're talking about statins and dementia. And the link. And I think the link is basically because statins interfere with the production of cholesterol, all right, in the liver, but also in the brain. And interestingly enough, the brain produces its own cholesterol because the blood-brain barrier prevents cholesterol from entering the brain from the bloodstream. But statins can do that. So it's inhibiting the proper use of cholesterol in the brain by the brain, increasing the risk of cognitive problems because that's one of the warnings on the label. But Big Pharma is fighting tooth and nail back and forth saying there is no increased risk of dementia from the drug or Alzheimer's, and don't stop taking it, okay, because the benefits outweigh the risk. Well, that's something between you and your doctor. I can't tell you not to do that, okay, believe me. That would be irresponsible. All I can do is tell you the stuff to do as far as what you eat and what your exercise is to help to increase or decrease cholesterol, bring it down, and all the risk factors involved with it. And here's another one. A growing body of research links type 2 diabetes with the risk for Alzheimer's. Now listen to this real closely. Type 2 diabetes, also known as adult onset diabetes, is a chronic disease impacting an estimated 34 million Americans. If left untreated, it can lead to a host of complications, including blindness, heart disease, and stroke. Researchers are also now finding possible connections between diabetes and increased risk for developing Alzheimer's. Just remember now, statins do what? Increase your risk of diabetes. Okay, here we go. A recently completed British study of over 10,000 men and women tracked the development of diabetes and dementia within a group from 1985 to 2019. What they learned was that the earlier the onset of diabetes, a younger age, the greater risk of developing dementia later. Even with controlling of other risk factors for dementia, such as race, heart conditions, and physical activities, researchers found a correlation between diabetes and dementia. The researchers observed the age at which diabetes was initially diagnosed correlated with the risk of developing dementia. For example, a 70-year-old diagnosed with type 2 diabetes had an 11% increased risk of developing dementia. Comparatively, those who developed diabetes younger had a much greater risk of developing dementia later in life. A 43% chance risk of later developing dementia for those diagnosed with diabetes at age 65. And a 77% risk at the age of 60. Whoa. Up to 81% of people living with Alzheimer's are estimated to have type 2 diabetes. 81%. While scientists are still investigating how diabetes is linked to dementia, it is well known that the brain uses enormous amounts of glucose. A hallmark of type 2 diabetes is associated with hyperglycemia, high blood sugar, due to insulin resistance. With insulin resistance, cells no longer respond to insulin, a hormone that regulates cellular energy and metabolism. A recent study conducted by researchers at UNLV showed that chronic hyperglycemia, high blood sugar, impairs and alters working memory networks. The study revealed the hippocampus and anterior cortex of the brain, central to forming and retrieving memories, were over-communicating and, as a result, causing mistakes. Insulin resistance in the brain is another growing area of investigation. In fact, Alzheimer's disease is sometimes referred to as type 3 diabetes. By studying brain tissue from deceased Alzheimer's patients, a team of BYU researchers discovered the genes used to break down glucose in the brain that have been compromised. Insulin resistance makes it difficult for the brain to break down glucose it needs for energy, but the brain could potentially draw from sources of energy known as ketones. However, the average American diet is high in carbohydrates or insulin-spiking foods, has fewer ketones available as alternative fuel for the brain. What's promising is this line of investigation points to lifestyle and the diet as the possible origin for Alzheimer's. Nearly 1 in 7 Americans have diabetes, and that's going up. And one of the drugs that they prescribe for type 2 diabetics is what? They normally have lipid abnormalities. They prescribe statins. Now, here you have an individual who's having a blood sugar problem as it is, and you give them a drug that increases blood sugar more and makes them more insulin resistant. Then you put them on blood pressure medication, which a lot of them are on. A beta blocker is a very common one, like Tenormin, metoprolol, things like that. What do those do? They can increase your blood sugar. What does that do? Makes diabetes worse. What does that do? Possibly push you towards the edge of becoming an Alzheimer's patient. 81% of type 2 diabetics develop Alzheimer's or have Alzheimer's. 81%. That's a massive number. It's a blood sugar problem. Cholesterol is a blood sugar problem. Dementia is a blood sugar problem. Alzheimer's is a blood sugar problem. Heart disease is a blood sugar problem. Our diet feeds the sickness. And the only ones who get something from this are the companies that sell you the medications to treat these problems. And the poor doctors, they're overwhelmed. You go into their office, you've got high cholesterol, you have high blood sugar, okay, you've got high triglycerides, you have high blood pressure, you're obese, and what do? Write you prescriptions to treat the symptoms of the problems that you've created from your lifestyle. They've done it. You're just going right along with them. You're like the little mice with the Pied Piper. They keep piping and you keep following. When it's all about lifestyle, exercise, nutrition. And with that, I asked my good friend, Dr. Justin Haggard, to call in. Hi, Justin. How are you today? You want to bring him up, Connor? All right, he's going to bring up Justin. Hey, Justin, I know you're there. How you doing, Justin?
I'm doing good. How are you doing?
I'm doing great. I'm sure you heard what we're talking about a little bit today, huh?
A little bit, yeah.
Okay. What do you have we're talking basically the brain. We're talking about Alzheimer's, dementia, the use of drugs to treat, like statin drugs to increase your risk of diabetes. Okay, and they can cause cognitive problems, things like that. And I know because you're in the field of chiropractic, I'm a firm believer in that, because when people look at chiropractic doctors, they just think of adjustments. But it's more, you doctors deal more with lifestyle. Okay, and how that actually works. Share that with us a little bit, okay?
Well, just like you've been talking about, lifestyle is huge. A lot of the things that the people come up with are preventable by having a better diet, having exercise. There's several pieces to the health pie, isn't there? Absolutely.
It's not just one little thing.
No, you've got to be careful of your thoughts, even, because your emotions can even play.
Big
come
time.
into play with your nervous system. You've got nutrition, you've got the vitamins that you need, and you've got the exercises to keep the heart going. But another thing that we focus on with chiropractic is posture,
Yes.
and keeping the spine from wearing out in certain places, which will pinch the nerve, go into whatever particular organ or body part, so that then it'll start to not work.
Yeah,
The power's not.
here's the thing I got a kick out of your general practitioner, MD doctors. You go there, basically all they're looking at is your blood work, and they look at the organs attached to the blood. That's blood parameters they show you or go over. Okay, and they never talk about the nerves that supply those organs to get them to work properly.
Every other machine, like if you're taking any other machine to a mechanic or any person who would work on that, the first thing they would check if something was wrong was the power.
Yes.
And that's what we do as chiropractors, is we check the power. And then we go look for the cause of the disruption in the power, and then we try to restore it. So we're working on causative problems versus just effect problems.
Yeah, see, that's why I'm a believer. And I have my back worked on and my body worked on by Dr. Mitchell every month. I've been going to him for
That's
about
great.
25 years because I'm a firm believer in it,
Yeah.
Go ahead.
Oh, that maintenance is part of it. Like with any other machine, our bodies are just machines that our spirit travels in, I believe. And the more they're either your vehicle or your jail.
Absolutely. And we're talking about the effects of statins on the brain and how important cholesterol is for the brain. When you read it, you say, what's wrong with these people? I mean, they cover the bus and say, the benefits outweigh the risk. There is no benefits that outweigh any risk. They did the same thing with the COVID shot. The benefits outweigh the risk. And what did they come up with now? All kinds of heart problems. Okay, now I got a heart problem. What do you got now? Now you got to worry about dying from a heart problem. Yeah. Yeah. Heart failure, weakened heart. That's really good, isn't it? Anyhow, this is from better aging. Cholesterol in the brain. Similar to the liver, the brain produces cholesterol by itself. In fact, the brain has the highest cholesterol content of any organ in the body. Now, you tell me this stuff isn't important. Most of the brain's cholesterol exists in the axons of nerve cells, where it protects cells and facilitates quick transmission of the electrical impulses. This has a big impact on how thought, movement, and sensation are controlled. It would make sense that statin drugs, which cross the blood-brain barrier and get into the brain, interfere with this process. The reason the brain creates its own cholesterol is that cholesterol in the blood does not cross the blood-brain barrier, meaning the brain cholesterol is used and recycled in the brain. There's one problem here. Some versions of cholesterol drugs, commonly referred to as statins, can cross the blood-brain barrier and therefore reduce the levels of cholesterol in the brain. Scientists are still learning the role of cholesterol in the brain, as well as the drugs they use to manipulate it and how they affect memory, dementia, Alzheimer's, and risk of stroke. A study at the University of California, Davis Alzheimer's Disease Research Center concluded that the higher levels of LDL and lower levels of HDL are both related to having more of amyloid plaque in the brain, a signature of people suffering from Alzheimer's. So anyhow, it says here that another study published in the Journal of Frontier of Neurology noted that high LDL cholesterol, while almost certainly a bad thing to someone in their mid-50s, can actually be a good thing from those in their 80s, stating that high levels of LDL may be considered a potential protective factor against cognitive decline. Well, what does that tell you? It isn't cholesterol causing the problem. It's something else. It's the sugar in the diet, the carbohydrates in the diet. When your brain can't metabolize sugar any longer, and you can't send the messages across the neurons, then the brain doesn't function properly. But then you give the brain ketones, BHB, beta-hydroxybutyrate, tremendous stuff, that is produced by the body when you are fasting or eating low carbs or keto, they call it. You produce this on your own, which then feeds the brain. But the good thing is you can buy this stuff too. It's called BHB, beta-hydroxybutyrate. 70+% of the ketones used by the brain and the body is this form of ketone. And statins interfere with this stuff, but taking this as a supplement can be very helpful. All right, so I'm going to put this out again. Here we go. If this sounds like you, and if it sounds like you're in my age group, okay? You're a boomer like I am. And you need somebody to understand you. You don't find that in a normal setting in most gyms or most personal training centers because most of your trainers, are in their 20s. They don't care really about what you've got going on. They're more interested in what they've got going on in their life. That's why a lot of them sit and they talk about what they're doing. They don't talk to you about what you're doing and let you talk to them. They talk to you about them. That's a fact. All right. We understand the body. So if you're one of those individuals, you have aging issues that are going, maybe you have joint replacements, you're diabetic, all right, you're overweight, you got these issues going on, then we're the ones you want to come see for a lifestyle program. Welcome back to the Good Life with Lance Dreher, Dr. Fitness. That's me. We've got, about 8 minutes? Is that what it is? Okay. And we're talking about the effect of statins and dementia, and we look at the numbers, and they're talking about by the year 2040, they're looking at 40 million Americans with dementia. 40 million by 2040, and you're looking at 16 years from now. Right now, it's 6.7 million. That's way up there. And we know one thing for sure: they're increasing the use of statins. They're not changing their diets. Okay, we have 81% of type 2 diabetics have Alzheimer's. Okay, you would think that these health experts would get together and say, "Here, we got a commonality here. It's blood sugar. Well, how do we change this? Diet and exercise." In fact, I'm looking at the Alzheimer's Society's website, and here's what it says about exercise: physical activity and risk of dementia. Regular physical activity is one of the best things you can do to reduce your risk of developing dementia. A lack of physical exercise is one of the main factors where the evidence is strong enough to show that it increases a person's risk of developing dementia. Studies looking at the effect of exercise in middle-aged or older adults have reported improvements in thinking and memory and reduced risk rates of dementia. I mean, it's right there in front of you. There's the evidence. Then I've got this, on ketones in the brain. Beta-hydroxybutyrate, the ketone that supports weight loss and brain health. The human body is capable of using two primary types of fuel: glucose, provided by carbohydrate foods, that's sugar, and ketone bodies made from fat that's on your body. When you follow a very low carbohydrate, high fat diet, also known as ketogenic diet, your body starts producing organic ketone compounds, including the type called beta-hydroxybutyrate. BHB is the abbreviation, which serve as an alternative fuel source to carbohydrates. What is the beta-hydroxybutyrate using for the body? Some of the most noteworthy beta-hydroxy benefits and uses include supporting weight loss, preventing or treating diabetes and insulin resistance. Yes. Helping and treating epilepsy, fighting cancer, protecting the brain, improving cognitive function, and potentially increasing lifespan longevity. Yes. You can buy this stuff too. Not only can your body make ketone bodies, including BHB, but you can also acquire BHB from ketone supplements. Exogenous ketones, or simply consuming foods like medium-chain triglycerides, can be beneficial for boosting the many positive effects of the keto diet and intermittent fasting. You can buy this. In fact, I take a scoop every morning, put it in my water, or I'll take MCT oil. But I also follow the Lance diet, which is low carb. Now, here are some of the other benefits of this. Weight loss. Prevents or treats diabetes. Makes you less insulin resistant. Fights cancer. Protects the brain. Has anti-inflammatory effects. BHB can help prevent the release of inflammatory molecules that contribute to various diseases affecting the heart, brain, bones, skin, and so on. Research suggests that BHB interferes with an inflammatory response, plus reduces the release of pro-inflammatory cytokines. Potentially increases lifespan. I mean, I can go on and on. That's what this diet does. But they'll still push this cotton-picking, low-fat, high carbohydrate diet and eat like a vegan, which makes it worse. We are not vegetarians. We're omnivores. Sorry to say. Omnivores. We're not herbivores. We're not like an elephant or like a cow or like a goat. We need animal protein. I'm not lecturing, by the way. So if you're one of those people I'm talking about and you need to make these changes, you're having a difficult time doing it, we can help you. It's not that hard. This is not a boring thing to do either. My diet, I love my diet. I can eat steak. I can eat shrimp. Okay, I have my cheat meals. I have 2 a week where I eat whatever I want to eat. I have tons of vegetables. And I feel great. I enjoy my life. I have a good life. I have a beautiful wife. I've got great kids. I've got great grandkids. And I want to see them for the next 30, 40 years. But I need to take care of myself to do that because they can't do it for me. I have to do it for me, just like you do.